Welcome back to the Inspectations podcast. This is Justin Starbird. I am here on the road today for the first out of the office podcast in a long time, talking to Charles Landry, the owner of Twin City Medical Aesthetics and Landry Osteopathic Healthcare. Charlie, thanks for coming on today.
No, thank you.
This is pretty exciting. You own a couple of different businesses here in Auburn, Maine. Tell me a little bit about, Twin City Medical Aesthetics and Landry Osteopathic Healthcare.
Okay. Started with Landry Osteopathic Healthcare. I'm an osteopathic physician. I specialize in neuromusculoskeletal medicine and regenerative medicine. So I do osteopathic manual medicine for a lot of work injuries, sports injuries. I see a lot of youth and even adult athletes, or a lot of workers' comp patients for injuries sustained at work. Handle migraines, tension headaches, back pain, rib pain, hip pain, knee pain. I kind of if it's a joint pain, I can probably address it non-surgically. So I do some of the stuff I do is similar to chiropractor. But there's a lot more stuff I can do in general from a technique standpoint, as well as I can prescribe if needed to prescribe medications. Let's say you have an acute muscle spasm, it's really hard to work through it. We can do a couple days worth of muscle relaxant. Or the other thing I do is regenerative medicine, which is platelet-rich plasma. So we draw your blood, spin it down, and take the plasma and the growth factors and inject it into the injured area and actually regenerate and heal the area and stabilize the joint.
That's great. So you really are able to help in all areas.
Yeah, and from a non-surgical standpoint, there's a lot of things we can do, and regenerative medicine is really on the rise. It's used in aesthetics, which is also what I use it for here too. And for sports injuries or work injuries, or just, you're the weekend warrior type, or you hurt yourself playing football 20 years ago and it's hurting you now. There's studies showing platelet-rich plasma injections actually getting rid of arthritis in some people. I've seen it in the case where someone had needed a hip replacement, and from a heart standpoint, wouldn't survive the hip replacement surgery, and they had PRP done, and it took about a year, but completely regrew the joint space, and didn't need a replacement. And that's not 100% typical. Usually we're looking at pain and function, not complete restoration, but it can happen.
Yeah.
And you can do it. And a lot of people go into and start researching, stem cells therapy is sort of the buzzword that everybody's looking at, but you look at the numbers, and the research articles right now, there's no difference in benefit between PRP and stem cells. But stem cells are going to run you, depending where you're at, anywhere between $4, sometimes $8, and $15,000 for a couple of treatments. PRP for usually need about three to four treatments is going to run you, depending where you're at, between $1,500 to $2,000 for those treatments, for the same benefit.
Yeah. So
I already know of several people paying $8,500 for something that I could fix for $1,600.
Yeah. It's interesting you say that, because we live in Maine, where a lot of people are still very active. They're, grew up in the community, live in the community, participate in the community, still some more, and don't even realize that these sorts of procedures or opportunities exist. Why do you think that is?
I don't know. I think a lot of Mainers are, kind of stoic. They don't like to go to the doctors, or they're put up with stuff, and you hurt something and you just move on. And they don't realize, or they think of it as super expensive and only available to, the Tom Brady's and Tiger Woods of the world. And, because they've all had, PRP and or stem cells. So they don't realize that it can be done, and it can be done affordably. Or they're used to a very, in a still kind of smaller town kind of atmosphere. You have like a closed community that's all owned by hospitals. And so the hospitals are going to push the very standard of care, which is, you do a few rounds of physical therapy. Here's some steroids. Here's a steroid injection to help you with your knee pain. The problem is, we're finding out from a research standpoint that's actually causing harm. It may temporarily give you pain relief, but it actually damages the joint and can increase the likelihood of you needing a replacement later on. Or especially, it's one thing if you're 80 and you have knee pain, well, a little steroid to calm that down, and that's fine. But if you're 40 with knee pain, you do not want multiple steroid injections and try to stay active. You want to rebuild that knee the best you can, and the only way to do that is with something like PRP or stem cells. And you can't. I think people just aren't as aware. I hate to say it, but hospital communities are closed. They keep the referrals within themselves in general. They don't go out of the box. A lot of those places don't offer regenerative medicine because it's the cash world, and it's really hard to live in the cash and insurance world.
Yeah.
Because unfortunately, regenerative medicine, although extremely powerful in showing that it works better than even most surgeries for certain conditions, it's just not covered by insurance.
Yeah. So what, you're thinking about, you go to the hospital or you go to your doctor who's in a network, a large, hospital owned network, and they get the diagnosis of, hey, go do this or go do that, get the steroid injection. What are some alternative questions that they should be asking that, that would then lead them to you?
Depends. A lot of the doctors here do know I do this, so they will, if you ask, they'll refer you over or give you the information. Is asking if there's something else. Is there something else non-surgical that you can do or that's more natural? The beauty about regenerative medicine is you're using your own body's healing powers.
Mm-hmm.
You're not adding drugs to the system. You're not doing anything. All I'm doing is concentrating the growth factors. I'm not adding anything else. I just take the red blood cells out so it doesn't hurt as bad and cause other problems. Because you don't want a lot of blood into a joint, but the plasma is hugely beneficial. And so it's asking if there's other options. Is regenerative medicine something you could consider? There's certain situations that absolutely no, you need to have surgery. But with someone especially when they tell you something like it's a partial tear or an incomplete tear of a meniscus or of a ligament, or especially the case of like a rotator cuff tear, is it partially torn? Is it torn but with retraction, meaning the tendon and everything has pulled away from the bone, and there's now distance between where it's supposed to be and where it is now? Or is it kind of torn off the bone but hasn't retracted? It's still there. If you ask those questions and the answer is, oh yeah, it's only partially torn, then regenerative medicine is something to look at.
Yeah.
And that's huge.
Yeah.
And again, it's just like everything else. Not everybody responds to everything. Not everything works for everybody, but you're looking at something that's safe and it's yours. And you got someone that's experienced doing it. I've been doing some form of regenerative medicine for pushing 20 years.
Yeah.
So, and had most of the procedures done to myself.
You were the weekend warrior.
Yeah. And I've injected my own ankle, my own knee. I did my own shoulder. So, it's what you have to do, and it's just ask. And also, because of the area that we're in, I try to do everything to keep the prices as reasonable as possible.
Yeah.
So, it's hard. You want to balance between you get what you pay for. You don't want to be the super budget, but just because, you're spending tons of money doesn't mean you're getting anything better. I told someone that, let's say, no matter what you do, it's going to take you 15 minutes to drive to work. No matter what car you have, it's 15 minutes you have to work. And when you have a limited budget and your choices are a Bugatti or a Volkswagen, and you have to pay the cash, and no matter what, both of them are going to get you to work in 15 minutes, why are you buying the Bugatti?
Right.
Obviously, because you get your work in 1 minute and you have the money to do it, then fine. But if there's no difference between the ride and the time it takes you to get there, why spend the huge money?
Right. Yeah, absolutely. So there's a lot to unpack there. That you're working in a community that, does value the Volkswagen and, saving money, and also that it's difficult to, ask the right questions to know that there are alternatives out there, because you're just not taught to necessarily go against, quote, the system.
Right.
And then, you're in a spot today where, you've been at this for 20 years, and most of your counterparts in other areas, whether it be further south or whatnot, haven't been doing this as long as you. What made you get started and go in this direction while you were, studying and in school and thinking, hey, I think this would be, this is leading edge now. It's going to be great now later.
Yeah. I had a lot of sports injuries and other injuries because of my weight and things like that when I was a kid. And actually, it was a chiropractor in the area that helped me the most. And I was actually at his house for his daughter's birthday. His daughter was in my class growing up. And I asked him, I said, you're the only doctor that's really helped me, but I said, I don't want to offend you in any way, but there's a role for medicine, there's a role for injections, there's a role for vaccines, and there's a role for manual medicine, obviously, because it helped me the most. And as I said, do I become a chiropractor and then I go to MD school and kind of blend my own thing? And he's like, no, you can be an osteopath and do absolutely everything. And I was like, I had never heard of an osteopath, never did anything. So it was actually a chiropractor that got me into it and taught me about it, and actually wrote me a letter of recommendation to go to osteopathic medical school, which they had never seen before.
Right.
They got a letter of recommendation from a chiropractor for someone to go to osteopathic school. And in the process, I just learned, surgery is hugely important, but it's not the be all end all. And people want to be active, and surgery takes a long time to recover from. So, if you can avoid the surgery that's going to keep you out of work for 6, 12, weeks, a year for some surgeries, and have a procedure that, you may maybe have a day or two of light downtime, and do it a couple times, and it's minimally invasive, and you can get back to work.
Get back to life.
Yeah, get back to life and support your family and play with your kids. You know what I mean? It makes a big difference. And so I really started getting into that. And some of the things I was exposed to in med school, I was very interested in cardiology. I was very interested in radiology. But ultimately, one of the things that really attracted me was, at the time, there was a company called Syngenics, and they really get into regenerative medicine and anti-aging and weight management. And I always thought that's really what I wanted to get into. And for years, I practiced where I was just doing the manipulation and PRP, and left that practice and started my own. And doing on my own, I'm like, well, I don't want to pigeonhole myself into just doing the standard thing and the insurance world and things like that. When, especially as I'm getting older, my kids are still really young. I need to focus on that, and I'm seeing more and more friends that are the same age as me. They're the mid-late 40s. And they're like, well, I still want to play hockey with the guys. I still want to play basketball. They're, still playing whatever sport they're doing, or rock climbing or cycling, and being active and coaching their kids or doing things like that. So what my wife and I decided to do when we started to grow this was slowly move into that world of still doing the manual medicine and helping with that stuff. And then moving into age management, weight management, aesthetics, and kind of blending the two. And, again, as an osteopath, I can do everything.
Yeah.
So, so as long as I'm not, anything I can do that's non-surgical to help people, I think is a great option. And people, again, want to have non-surgical options that are still effective and safe, because they don't want the downtime. They want to continue with life.
Well, that's a great point that you know, got started, and as you got started, realized that there was a couple of directions and ways in which you could help. And this is really sort of like a restart for you too, where you're, launching on your own, which, having been somewhere else previously, now you're out on your own, which is exciting. You have the osteopath side, but now you also have the Twin City Medical Aesthetics, which is a different business, but in a lot of cases, it's the same clientele. You're also in a unique space because you're in Auburn, not further south in Falmouth or Portland. What is the difference? What does that side of the house do?
So, Twin City Medical Aesthetics, we offer skin tightening, wrinkle treatment. We can do fillers, or we use Xeomin instead of Botox. I just like Xeomin better, but it's similar to Botox. It is a Botox toxin. It's just a different name brand that's designed a little bit differently to help with wrinkles and things like that. And we do radiofrequency microneedling. So if you haven't heard of radiofrequency microneedling, it's exactly what it sounds like. It's small needles that are, injected into you, and they send a low current through to help, one, melt fat, and two, stimulate collagen formation. So after the age of 30, you can think of it as your collagen packs a trip to Italy without you. And you progressively lose more collagen every year. And so but you could do things like radiofrequency microneedling to tighten it up and to get the collagen to grow back, and tighten your skin up, get rid of those fine lines, or especially in the case if you've lost a lot of weight, and you want the turkey waddle and the neck gone, that to go away. The radiofrequency microneedling can handle that. We do IPL, which is intense pulse light, and that gets rid of red and brown spots. It can help heal rosacea without drugs. It can get rid of acne, and it's safe to even use in kids. So you have, your high school child's going to get their senior photos coming, and they have, or prom, and they have a bad acne breakout, and they're getting it almost worse by using tons of makeup to cover it up, or something like that. We can get rid of it with a few treatments of IPL. No drugs, no antibiotics. It's just using light to kill the bacteria and heal the skin. We do laser hair removal, and we also offer semaglutide, also known as either Ozempic or Wegovy, to help people lose weight. And you can get near surgical response and weight loss with the semaglutide, without surgery. Without the problems and complications of surgery, and and way less money, and it's been I also, with the weight loss, is something that's also very important with PRP. So that's also where I've been finding I've had to really integrate the two practices and kind of offer both worlds. Is, you have someone that you have bad knee pain, or you have back pain, but you need to lose weight to get the knee pain and back pain better. But it hurts to exercise, so there's a couple different ways depending on the patient and depending on how much weight they have to lose. We blend it. So I got someone that's gonna really, they're fairly functional with their knee pain, but it's problematic, but they want to do the PRP, but they're still too heavy that the PRP is not going to be as beneficial. So they're going to be like, all right, well, I got to lose weight, but it's hard to exercise with the lose weight. And I said, well, why don't we try the semaglutide, get your weight down, and then transition you over to and then add the PRP when you're at a weight that's going to, you're going to get your better bang for your buck. And that's what they're doing. Or other people, it's the other way around. Their knee hurts so bad they can't exercise, they can't do anything. So we do the PRP, strengthen the knee, take the pain down so they can start exercising and then get on a weight loss program.
Yeah.
It really depends on the individual. And I tell people, I can guide you, but it's your body, it's your health, it's your checkbook. You need to look at what can you be the most consistent with, what's better for your lifestyle, where do you want to go, and then I'll just help you through whichever path you choose.
Yeah. Well, and truly, there is no, uh, you know, um, ability to, your body is most important, right? And so, I mean, money is a concern for sure. How did you come up with bringing the two together? I mean, that's going to be, it's totally unique from what I understand. And
Yeah.
most practices are very much either one path or the other. And kind of like the chiropractor giving you a recommendation, they usually don't cross over.
Right. One, I cross over because I can. Two, I'm really interested in it. And it's also from a business standpoint, very difficult to just walk into in this economy and just do 100% cash practice without a lot of money backing up. To fully start a base aesthetics practice is a minimum of $1 million.
Yeah.
Just to get it going. Well, you want to get your return on investment as quickly as possible. So that is something that we found we just couldn't do. And I think a lot of people haven't done it here because they just don't feel that there's the demand. And I think that's a bad assumption. There is the demand, and there is the interest in doing that, but it's just very difficult. And I didn't have the ability to do that. So what we've decided to do is kind of take our interest and grow and then find a way to live in both worlds so I can still treat the people that have back pain and headaches and just need manipulation, but then also while they're having back pain and they've getting manipulation, but it's not going away, and they're exercising and they've done PT. Well, they're only 40 and they're looking at potential surgery, but they're not a surgical candidate either because of their weight or because of their even though they have severe pain, their issue isn't operable,
right?
And then they're getting into steroid injections, and which you keep steroid injecting a facet joint, which is the joint of the spine. You're going to eventually deteriorate that joint even faster, and then eventually you're buying yourself a fusion. So I just always kind of found, well, everything kind of works. And unfortunately, not everything's covered by insurance.
Yeah.
So, it's trying to get the best for everybody. And it was the original idea to really blend it and kind of do the two practices was one, I had a patient who had done PRP on and a bunch of injections. And then she went someplace else to get a lot of aesthetic work done. And she came to me, she's like, why are you doing this? And I said, well, I like it and it helps people. She said, I see what my insurance pays you. She's like, you're way better with a needle than the guy I just saw. She's like, I paid him $2,500 cash. You got $65 from the insurance company.
Yeah. She's
like, why are you doing this? And I'm like, so morally, ethically, as a physician, as someone who wants to help people, I want to do that. But unfortunately, the reality is there's a business world too. And then I had done a lot of plastic surgery as a student and as a resident as well, and was really interested in it. And then I was like, well, why don't we do both so I can really help people in multiple facets, help people feel better about themselves and help people be better.
Yeah.
Because reality, people need both. You know what I mean? Especially, you have the case of you've just lost a lot of weight, well, and you get a new job, or you're starting your own business, and you're now the face of that business, and you want to tighten it up. So, you know what I mean? So the nice thing about here, it's one-stop shop. We can do both. We can physically help you get back into life, and then also help you feel better about yourself and do more. And then my wife's an RN, and she's all certified for the Botox and the filler and to run the radiofrequency microneedling. So her and I do that together. And so she does most of the aesthetics patients. and evaluations, and I go in and double check, and we come up with a plan together. If someone actually has a medical condition that we can help that in a way that's not covered by insurance but is more natural, we go through that. The other thing that's different about us, we're not just estheticians that are doing some of these procedures, because a lot of times people have something wrong with their skin, and it's a real medical diagnosis that needs to be treated otherwise. Like, I've had someone come in and they're like, I think I was told I had this by somebody, and they didn't. I had to get blood work and say, no, you actually have lupus. So you need to medically treat your lupus and not aesthetically treat things. So we can help speed things up that way too, because if you hadn't seen your primary and you just saw someone for a massage and a facial, and they're like, oh, we think you have this and you need to buy this package. My wife and I have the ability to look at it and say, no, you actually have this condition, and you need to go more of a medical route, or you were told by someone you have this medical condition and they actually don't. You have something that we can fix aesthetics alone. Because reality is a lot of people have something of both. So why not offer something of both?
Is this something that you had seen before? Did you and your wife have motivation because you thought, oh man, I saw this in Beverly Hills or Newport Beach and Miami, and then we're like, hey, we can take this to Auburn, Maine.
Yeah. Other than like Syngenics, I don't even know if they're in business anymore or if they're under another name. I saw them down in Boca at a conference, and I hadn't heard of it. It's sort of I had a couple friends of mine say they tried to start it. One of the doctors I worked with in Iowa, he was starting down the same path, and due to some, I think there was contractor issues on the building he was doing, ended up being a big legal battle, ended up just not going it, and trying to go on your own in certain markets is really hard when they're all owned by hospitals.
Yeah,
and you're having to compete with that, and getting staff and doing all that work. It's really hard to do both worlds. And so we decided to do it step by step, process by process, device by device, and use our skill set that's the strongest and use that first. And where can we offer in both worlds? And then in the process, we're learning other tools and avenues that we can use to build upon and then offer people. And I think that's a way to be able to keep the price down for the patient, able to keep our costs down, but provide good quality service, a good quality product, and with as little runaround as possible.
Yeah. So I got to ask you this: why Auburn, Maine, and not Boca?
I grew up here. I grew up in Auburn. I went to Holy Cross and St. Dom's. I went to University of New England for undergrad and med school, the Twin City Medical Aesthetics. So my dad's first job was Twin City Dental Lab. My dad was a dental tech. And so when I started this, I wanted to give it some honor to his history and things like that. So, and I wasn't sure how much I was going to go either between Lewiston or Auburn. So I figured, Twin City and unite two and do that. So that was the idea there. And I wanted to stay here. My wife's family is in Oxford mostly. It's just why not be here? And give people what they want. They're driving to Brunswick, they're driving to Falmouth, they're driving to Portland. We can do it here. And that's where our family is, and this is where our roots are, and that's what we want to offer.
That's exciting. Well, Charlie, this is the start of something great. I'm looking forward to this. We have, a couple more of these interviews planned to unpack some of the processes, procedures, and the reason why you do them in the coming weeks. So this is great. Thanks for joining me today.
Awesome. Thank you very much for having me.
On behalf of Dr. Charles Landry, you've been listening to the latest episode of the Inspectations podcast. Thanks. Until next time.